talking to patients about cancer and cancer treatment can be challenging. These conversations can raise complex clinical issues, and seeing your patients going through grueling symptoms and side effects can draw up difficult emotions for us as clinicians. But these conversations can not only benefit your patient's well-being, they can also significantly improve their outcomes and reduce the risk of complications. Approaching this the right way can empower patients to make informed decisions about their care, manage their symptoms, and cope with the emotional impact of their diagnosis, treatment, and recovery. With the support of the brilliant BOPA community, these videos will explore how we can reach out to patients who are living with cancer in primary care, along with helping you to manage some of the side effects we can help with in this sector. For a more in-depth look at this, there's no better place to start than BOPA's Let's Communicate Cancer program, which is available for free on eLearning for Health. This provides a detailed look at each stage in the detection and management of cancer, highlighting opportunities where we can get involved in primary care. Each patient's journey through this and the impact it has on their families is unique, and in healthcare we often only get to see small pieces of this journey. So if you do only one thing after watching this video, I'd recommend Module 5 of this program, which is called Jackie's Story. Jackie has kindly shared the story of her diagnosis and treatment of breast cancer. And by listening to Jackie's eloquent descriptions of the challenges she faced, you'll get a deeper appreciation of your patient's story. This will add so much weight to the actions you're going to take to help them, so I genuinely can't recommend this highly enough. For a more general overview of the patient journey, this American resource divides it quite nicely into 4 stages. This begins in pre-diagnosis, when unusual signs or symptoms lead a clinician to request further investigations. Increasingly, this journey begins out with the GP surgery, with campaigns like Not Normal for You, coaching staff and community pharmacies to detect and refer suspected cancer symptoms. In stage 2, these investigations have gathered a clearer picture of the person's diagnosis and severity, helping the oncology team build a treatment plan for them. They'll then begin the huge challenge of treatment, which could involve a combination of surgery, radiotherapy, and systemic anti-cancer therapy, or SACAT. SACAT's a broad term which can include chemotherapy, immunotherapy, targeted therapy, hormone therapy, or a combination of all these treatments. This plan and the challenges it'll bring will be individual to the patient. Each intervention carries with it risks and complications and detailed advice for your patients to navigate, creating significant challenges not just for their physical health, but also their mental health and their emotional well-being. Despite these challenges, every day thousands of people around the world enter the survivorship stage, where the focus becomes rebuilding their physical and emotional health. Their journey through treatment might have permanently shifted the way they see themselves and their health, and some people call this their new normal. So much of the survivorship stage involves helping your patients process their journey so far and figure out where they want to get to with their recovery. So when we ask ourselves how we could help these people in primary care, it's clear we're in a brilliant position to support patients throughout every stage of this journey. We already have some great campaigns helping us to get involved in stages 1 and 2, but I feel there are opportunities we sometimes miss during the treatment and survivorship stages, so this is where we're going to focus our attention in these videos. As you progress through the videos and gain more experience exploring cancer with your patients, you'll see that these challenging conversations can be profoundly rewarding, allowing you to foster deep connections with your patients, and they'll value the support you gave them long after they enter the survivorship stage. See you next time.